Hello, welcome to this webinar on parents and foster carers working together. Good to see everybody. We've had a lot of people registered. It's really great to have so many people on. We're just going to wait for a few moments while people join us. Hello, welcome everybody. It's good to see you. Please do feel free to introduce yourself on the chat. Just going to wait a few moments while people join us. Hello. Hi, welcome everybody. Welcome to this webinar, the fourth webinar of our foster care practice series. Good to have you all with us. Hi, hello, welcome. Going to wait just another minute or so, just while people join us. Hello. Hi, thanks for introducing yourself on the chat. Great to have you here with us. And I think we can get going and just introduce you to this webinar. This is our fourth webinar, and we're going to be talking today about parents and foster carers working together. So just to let you know that today's webinar will be conducted in English, but we'll have simultaneous interpretation in Spanish. If you'd like to access the Spanish interpretation, there's instructions on the slide now of how to do that. Yeah, a few more people join us. It's nice to have you join us. Thanks for being here. The instructions are on the screen now as how to access the Spanish interpretation. Okay, well, it's great to have you here with us today. So today's webinar is being hosted by the Transforming Children's Care Global Collaborative Platform. And this is a platform as a community of actors and organisations that are engaged in child protection and care reform. And the overall vision of the platform is to establish a more strategic sector-wide collaboration from the global to the local level by coming together and building on one another's work in order to secure a greater and more sustainable impact, as well as undertaking joint advocacy. There's going to be information on the chat about how you can join the platform. It's open to everybody, and there'll be information how to join. As a member, there's lots to be involved with, different groups that we'll talk about in a while. So please do sign up with the link and join the platform, and you'll receive updates about future webinars as well. Okay, so thank you all for joining us. I'm Louise Cox. I work for the Martin James Foundation, and it's my pleasure to be here and co-convening this webinar series and the task force on foster care, alongside my colleague, Barbara Aber. Barbara is the Regional Family Care Advisor for Catholic Relief Services, and she will be hosting the panel discussion later in the webinar. So today's webinar is being recorded, and the recording will be available to you in Spanish and in English. We'll also be sending the slides from the presentation out to you. As people have already started to do, it would be great if you could share on the chat who you are and where you are in the world and where you're working for. That would be great. It's great to see so many people on the webinar today. The Q&A function will be available today. So if you do have questions throughout the webinar, please do put them on there, and select the panelists and attendees so everybody can see the questions. We hope to get to answer some of your questions today live on the webinar. Not all of them might be possible, and therefore some of them will be taken forward after the webinar and we can respond to you later, and also at the foster care task force that will be convening next week. Thank you. So today is, as I said, our 4th webinar in the foster care series. So today we're going to be thinking about parents and foster carers working together. Our final webinar will be in September, on the 15th of September, where we'll be focusing on children and young people's participation in decision-making in their own lives. So please do join us for that. The registration is already open, so please do register and join us. Today's webinar, we're going to have presenters from Mother's Choice in Hong Kong and from the International Parent Advocacy Network. And like I say, after the presentations, there will be a panel discussion and some time for some question and answer. So to introduce you to our first speakers, we have Leah Wong, who is the Director of Services for Mother's Choice. Leah oversees the services case management. She's passionate in child welfare and committed to be the voice for children in their best interest and to pursue their permanency plan. Leah holds a degree in social work and a master's degree in counselling from the University of Hong Kong and has extensive experience working in social welfare. At Mother's Choice, Leah has led the development of Project Bridge, the first private fostering programme in Hong Kong. Leah and her family are an approved foster family and have fostered 5 children since 2017. We also have with us Kay Dong, who is an approved foster carer through Mother's Choice project since 2016. She has since opened her home and her heart for children. In the past 6 years, her family has cared for 7 children with adoption and family reunion plans. We also have with us Chloe Banks, and Chloe is the Child Protection Lead and Safe Families Manager at Mother's Choice. She has overseen the launch of Safe Families in Hong Kong, which is a family strengthening program to build community friendships and support young parents. Chloe has an MA in International Development and has worked in child welfare in mainland China for 7 years. Chloe's family have previously been foster parents and she is an adoptive parent too. So I will hand over to you. Thank you so much.
Great. Okay. Can everyone hear me? Oh, they're great. Lovely. Well, thank you so much, Louise and the whole team for having us here today. My name is Chloe Banks. Yeah, today we're going to be talking about Mother's Choice. We're based here in Hong Kong, and just the challenges and the innovations that we've seen and that we've tried out in foster care over the past few years. And that includes in family preservation and family strengthening. So I'm really thankful to be here today with my colleagues and foster parents as well. Next slide, please. So who's Mother's Choice? We are a local Hong Kong charity. We serve the many children without families and pregnant teenagers here in Hong Kong. Now, our vision is to see every child in a loving family. And when we say family, we believe a family should be a family that is safe, a family that is loving, and a family that is permanent. And as you can see, it is such a huge vision. It's not something that one organization can do by ourselves. And that's why our mission is to join hands with our community to give hope and change life stories. And I'm so excited today that we're actually joining hands with our global community, not just our local community. And it's wonderful to be able to just learn from one another and share experiences. We run a number of different frontline services. We'll touch upon some of them today. In teen crisis pregnancy, we have different residential care programs for children in care, including foster care, residential care, and we also have prevention services such as comprehensive sexuality education, child protection, and advocacy. And we also run local and inter-country adoption services, as well as Safe Families, our family strengthening program. Okay, next slide, please. Now, just a little overview of the Hong Kong system. So everyone, I've seen the list of everyone coming, and it's amazing to see in the chat where everybody is coming from today. So a small overview of our system. You might see some similarities with the system that you're in, and maybe some differences as well. I think the main thing that we have in common is that we're all in this child protection crisis, but the reason that we're here is because we have hope. We want to bring change, and that's what we want to see. So some of you might be looking at this slide and thinking, those are really small numbers, and we're a city. We're a city, and we have 4,000 placements for children in our care system. But the main thing that we just want to highlight here is that those numbers, 3,900 placements for children, actually we're at full capacity as a care system, and we have been for many, many years. And we have almost 400 children on a wait list for placements. And we've had some very tragic cases over the years where children have been living in very unsafe places and have actually even died because they have been waitlisted for care, and they have not made it into care in time. And why do children live in care? Well, you can see here that less than 20% is due to abuse or suspected abuse, and 82% is due to temporary lack of appropriate care. And that means that in 82% of situations, there's potential for us to walk alongside a family. There's potential for children to return to birth families. Where do children live in care? We have almost 50% living in residential homes and 24% in small group homes. So as you see that number, that is more than 70% of our care system is institutional, living with paid caregivers in a residential place. And Hong Kong too, many of you may think of Hong Kong, think of this very shiny city, rich city. Actually, we're still one of the only places in the world that runs residential care for babies in such an economically kind of powerful places as Hong Kong. And so the question that we're always asking is, okay, we've only got 30% of children in foster care, and how can we grow the foster care segment? And not just grow it, but also grow it in quality, and also make sure that children don't just enter into care, but they can get out of care into this safe, loving, and permanent family that we so long them to be in. Okay, next slide. So where are children leaving care to go to? And now these are statistics that are really difficult to understand sometimes, even for us. So we've got at least 60% are going to family reunion, but we actually know that less than half of this number actually achieve family reunion. And many of them are going to a different placement, a placement change. A very small percentage are going to adoption or independent living when they turn 18. But there's also this unknown segment. There's real data that is being lost, so we don't even know where some children are going. And there's some challenges and opportunities as well. And if you move to the next slide, just some of those things that we're going to be talking about today. And there's some of the things that I think probably everyone in this room will have some experience in. There's bias against parents in the system in many different ways, and we're navigating this fragmented system that is that's difficult to navigate. It's difficult for social workers to navigate, let alone families to navigate. And families and children have frequent changes in social workers and in assessments as well. But we have hope. We have been able to innovate in a few different ways, and it's not just ways that we've had help from many places and people around the world. It's not just us coming up with solutions. We've adapted programs. We've talked to people with the same challenges as us. And so we're going to be sharing some of those innovations that we've tried today, and how we've managed to expand our family care placement, and how we've managed to build, even just within our own agency, a common language when we're talking about placement quality, when we're talking about just all sorts, everything surrounding the placement and also the permanency of children. And we're going to be talking a little bit about how parents and foster carers can work together. So if we go to the next slide. Actually, most of the rest of this presentation is actually going to be an interview, because we thought, how can we really bring this to life? So I'm very thankful to be able to introduce to you our Director of Services, Leah Wong, and also one of our foster carers, Kay Dong, who is also on one of our committees at Mother's Choice, really helping lead our organization. So I think we can actually take down the slides, and so you can see everyone. Great. So hi, Leah. Hi, Kay. It's great to see you tonight. I'm going to start with Leah. You are not only our Director of Services and Case Management, but you're also a registered social worker. And can you share a little bit about some of the challenges facing families when they interact with the child welfare system when their children are placed into foster care? Can you share about some of the backgrounds of these families?
Thank you, Chloe. Good morning and good evening, everyone. It's lovely to be here today. And I'm Leah. Nice to meeting you all. So thank you for the question, and thank you for the great introduction on the care system in Hong Kong, Chloe. And for the question you asked about the background of parents who have children in our care, I think 20% of our cases coming into our care with a child protection order, which means the children are being removed from the parents' care because of abuse situation, and that has to be through a court order to be placed in our care. And the rest of the 80% are placed in care voluntarily. That means the parents consented the child to be placed in out-of-home care, and they will be working with the social worker to realize the different steps that they need to do in order to reintegrate the children back into their home. And in fact, majority of the parents are coming from very challenging situation themselves. They might have experienced different trauma. Many of our parents also struggle with mental health issues, drug issues. They are also victim of domestic abuse. They also experience poverty. You may also know, like in Hong Kong, 1 in 5 Hong Kong people are living in poverty. This is also the highest number in the recent 12 years. So you can imagine a lot of our parents are struggling with a lot of financial situation, unemployment, and housing situation as well. So we also have parents who are our clients coming from our pregnant girl services who are currently facing crisis pregnancy. They themselves also growing up from the residential care system. So you can see that there are already facing a lot of challenges in their lives. And there are also many challenges when their children is placed in foster care. So as Chloe mentioned, there are bias against the birth parents. Honestly speaking, it is really challenging sometimes for some of the foster family to work with the birth family who has drug background or mental health issues. There are still stigma that they might just probably have emotional breakdown during the visit. They might be very difficult to work with. The foster family might not be feeling very confident or feeling equipped to work with the parents with such background. So they might be also even very not very optimistic on they will be able to realize the family reunion plan. So this is one of the biggest challenge that the parents are facing. Another really like significant challenge I think we all are very familiar with is the fragmented system that is really difficult for the parents to navigate. As mentioned, a lot of our parents who might have mental health issues, they need to navigate different mental health clinic, they need to navigate the drug rehab appointments. They also have a family social worker, they have a foster care worker. You already have 4 different social workers in their life, and they have to navigate different policy and procedures in different services and agency. And the services are really segmented, it's really isolated, not coordinated. There is no mechanism for us to really exchange information. It's really difficult for us to really work on the same case planning for our clients. So that's also frequent change of social worker, and also the change of assessment and practice when there is a change of social worker, because we don't really have a standardized assessment tools and a way to really articulate the needs of our clients. So the parents really confused how to navigate along their case journey and also the permanency planning of their child. So I think, yeah, that's overall the situation.
Great. Thank you, Leah, for unpacking that. I think a lot of people in this webinar today will be familiar with a lot of the things that you shared. So one of the challenges that we started looking at Mother's Choice was just thinking, you know, the pool of foster parents that we have has really not grown for many years. And we sort of started looking, you know, into that. And you, Leah, you led a brand new program, a Mother's Choice for Project Bridge, to really expand our pool of foster parents. And can you share a little bit about that today?
Yes. Yeah, for Project Bridge, I think we've observed that there is a foster care pool in Hong Kong has been really stagnant for a long time, with little growth, both in capacity and also the practice and approach in operating the foster care system. So Mother's Choice, I think, took the opportunity to really pilot a private foster care program with the endorsement by the Social Welfare Department, the government in Hong Kong, with the goal to expand the number of foster families in Hong Kong. At the same time, we really want to use this pilot program to try to experiment some new practice to see if this would be working in the larger foster care system. For example, we have enhanced our home assessment guidelines. We recruit our own foster family from different demographic profiles. We approve highly motivated volunteer families without any stipends provided. We will be able to really do our own recruitments, because I think for the central and for the foster care system in Hong Kong is all centralized. So the Social Welfare Department, the government centralized the foster care home pool and also centralized the referral of children. So whenever we need to match a child with the foster family, we need to identify the foster family in the central home pool. We barely know the family. We only know the family by reading the home study report, which is not completed by Mother's Choice. So we can only know the family through that home study report. It's like a blind date, actually. We match the child with the family. We only know a little bit of information based on the home study report. So through Project Bridge, we will be able to recruit, assess, and train our family. We get to know our family, their personality, their strengths, their lifestyle, their different, really their different strengths, so that we can match them with the needs of the child, and so that we can be really like match the suitable placement for the child who are needing the really the foster home. And also that really enhance the stability of our placement and also the efficiency for us to be able to admit the child into a placement as well with a suitable foster family. So that's the two biggest pilot that we try in Project Bridge. And also we build up a buddy system to prevent burnout, because I know I think everyone knows foster family is not an easy thing. They all need support. We all need support. So we pair up with the regular foster family with a relief family whenever they have a placement who need to care for a child for over 6 months. So we make sure that the buddy system, the buddy family, will provide the support to the regular family to check in, to offer respite, so that also the child will be able to have a consistent relief care whenever they need a relief care from that family. So I think that's the 3 key enhancements that we are trying in Project Bridge. And in fact, I think we are, with the blessing from the government for us to try the new project, we have so far recruited, trained, and approved over 100 Project Bridge foster families, and who have cared for over 140 children so far. And through the program, we were able to meet with so many passionate, motivated foster families like Kay, and Kay is one of the most passionate foster family we have met through this program.
Wonderful. Thanks, Leah, for sharing that. You know, one of the interesting things that we looked at for Project Bridge is thinking, you know, there's a group of quite a big group of people who have never been sort of tapped for foster care, and they are working parents. Previously to that, we hadn't really had, or that there's within the system, there isn't really space for working parents. And we thought, I wonder if we could actually ask people to do foster care, not for a stipend and not where there's funding involved, but would anyone do it for free? And you know, most people who we suggested that idea came back and said, that's crazy. There is nobody who's going to do one of the hardest jobs on earth for free. And Mother's Choice, we sort of we're a piloter, we're an innovator, and we thought let's just see. And so Leah, as you mentioned, that 100 those 100 people that we've approved, that actually all volunteer foster parents. And Kay, you were actually in that first batch of foster parents that Mother's Choice was able to recruit, and I'm so thankful that we did. Can you just share a little bit? You know, what was that original motivator for you and your family to say, you know, we want to do this, we want to get involved, we want to be foster carers? And not only your original motivator, but why do you keep doing it? Why do you keep coming back to it time after time? So we just love to hear your journey to that decision.
Thanks, Chloe. Hi, everyone. Thank you for having me here today. So I think it all started back in 2016 when I read a news article, and that news article really shocked me to my core. At the time, it was about a 5-year-old boy who died from a meth overdose at home. His mother and her boyfriend were drug addicts, and they suspect he picked it up somewhere from home. But how this led to foster care was because I then found out that this boy was actually waiting for care, residential care. But as Chloe already mentioned, our system is maxed out and there is just no placement available. And so therefore he was stuck in this very unsafe environment. So this led me to dig into why this is even happening in Hong Kong. I just could not believe it. So I read about it and I decided to contact Mother's Choice to learn more. Mother's Choice told me about foster care. And I have to admit, before that call, I knew nothing about foster care. I knew nothing about the care system. But it was just at that moment, I felt I had to do something. There was a really strong pull and a really strong calling, and my heart was aching for weeks and weeks, and I just knew I had to do something. So very soon after that, discussing with the family, I'm a mother of 2. So after discussing with my husband and my children, we decided to sign up to become a foster family. And since then, we have taken care of 6 children. Some of them have come to us and as little as 3 weeks old. And I have to say that although it's been really difficult, physically, mentally, challenging, it's such an important part of our family story. And for me, it's challenging because I'm a full-time working parent. I have 2 children that are in secondary. So everyone's well-being is always on my mind. Like I want to make sure that everyone is is well, because the journey of foster care is so many ups and downs, so many uncertainties, cannot really know anything for sure. And especially when a child leaves, it's just so heartbreaking. I mean, like the house is like dead silent for like for weeks, and it's really yeah, it's one of the most, like, I can't even explain it in words, right? That feeling. But the reason I keep doing it, and after every placement, we always say we're going to take a break, you know, we need a longer break. But every time I get a call, you know, okay, yes, we'll take him, we'll take her. It's so hard to say no, but the reason we keep doing it is because I think it's just such an honor to be able to change a child's life, and to be able to be part of that really important stage in their life when they really need someone, and to be able to step in and be their champion for that short period of time, I think is just such a gift and such an honor. And every single child is so different. And so seeing them, you know, reach those milestones, and seeing them grow and flourish, and seeing their personalities develop, I just find it really fascinating. I'm really motivated to see the children when they're with their forever family. So whether or not that is a adopted family, or they go back to their birth family, that is their forever family. And every time I see them with their family, I'm just so, I tell myself this is the reason I do it. And so as long as there is a need, and in Hong Kong there is a huge need, and as long as I still have the capacity, I will continue to do this, and also to inspire more families and friends to also join and do this, because it's just so meaningful.
Oh, thank you, Kay. You're not only just a wonderful foster parent, but also a real advocate for change in our system. Can you share a little bit about the training that you've received before you became a foster parent, and also along the way as different just different scenarios come out with different kids each time, and a little bit about that partnership that you have with your social worker, and that support that you receive from them?
Yeah, so as I mentioned, I'm not a social worker, and before I signed up to be a foster carer, I had no idea how the system worked. So I was really glad that we had a lot of training and support that was offered to not only myself, but my family and the caregivers in my family, before we accepted our first placement, because I think most people like us just have no idea what is involved. So I think the foundational training around what's child protection, how do we protect this child, and child development, and understanding the different needs of different children, understanding attachment. I really had no idea about attachment, and I even naively thought, okay, I should not get so attached to the children, where in fact that's the whole point. So the whole point of it is to show them how to attach, right? And understanding the foster care system, and helping us, if it was, you know, how do we work with birth families, and so all of that foundational training was really, really important in the beginning. And then throughout the foster care placement, Mother's Choice will offer different trainings along the way. So training about, you know, trauma, how to handle grief, and like how do we handle children with maybe in utero substance exposure, etc., and how to look for those signs, and how to go ask for support, and also like how to take care of our own well-being. So all of that was really, 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 really great and available to us. But I would say what's really helped me is my relationship with my social worker. So I've had 6 children so far, and I've worked with different social workers, and really they're my rock. Like, I think without them I would feel very lonely, and it's a very scary journey. So they help me with big decisions. Sometimes I don't know if it's the right thing to do, or I don't know how to handle a situation. It can be very, very nerve-wracking if I don't have that support. So I think the relationship with the social worker is so critical. And with technology now, it's just very, very convenient, through WhatsApp, through being able to reach them on the phone 24 hours a day if there's an emergency. So and certainly I think each time we have to say goodbye to a child, that's when I really feel that the social worker is by my side and like supporting me, supporting my entire family, and just helping us through that grieving process. So it's really great.
Great, thank you, Kay. Leah, can you share a little bit about just some of the communications work that we do in trying to facilitate communication between all of those different stakeholders in a child's life, and the parent and the child and the foster parent, and as you mentioned, they might have up to 4 social workers, and so we've implemented a tool called CANS, the Child and Adolescent Needs and Strength. It's an assessment. Can you share a little bit about that, and how we can use it to do better for children, so that we're really all on the same page regarding their placement and their permanency plan?
Thank you, Chloe. You already mentioned everything I want to say. So CANS, it's a communication tool that we are using in Mother's Choice in order to collect all the information about the cases and translate that into the ratings, 0, 1, 2, 3. Actually, it's really, really easy to use. It's drive our actions, and actually it's focused on the needs and also the strengths of the child and the family. So with the CANS, we will be able to identify different needs of the child and families, and then we put together a plan based on the needs that we identify, and also build on the strengths that we think that would be useful for the case planning, so that everyone who are involved in the case planning of the child, the foster family, the birth family, the different social workers and multidisciplinary professionals, we're all working on the same service plan based on the CANS rating, which are the needs of the families, which are the needs that we can all play a part to address, actually, because there are many needs the family might have, and Mother's Choice will not be the only agency who can address all the needs, so that we join hands with the other partners and other stakeholders together. With these tools, we will be able to communicate consistently on a structure framework with all the needs structure in one place in the service plan. And then we will be able to keep track on the progress, to review whether the case is progressing well in addressing some of the needs. We can then celebrate the success, or we can adjust the plan if this is not really working. So I think this is a really great tool to really let us collaborate and work on the same shared vision by using the CANS. Thank you.
Great. And can you also share a little bit about how you see foster parents being a real support to families whose children are in foster care, and how they can really work together in that? from a social work that perspective?
I am actually very moved to hear what Kay just shared. Honestly, I really would love to see more and more families like Kay stepping up and coming forward to become foster families. This is such an honor and a privilege to be able to work alongside with all those foster families and serve the vulnerable children and families. I think that there are many things that those foster families are doing, which is very helpful to support the children and also their families. Things are helpful, like they facilitate the visitations, not just the physical visit. I think it's like the bonding between the parents and the child. They will prepare some ideas on how to engage the birth parents to play with the child, to really share the little update about the child, different milestone, like they're walking, they're rolling, they are doing different kind of things. Those are the really important things that the family would feel they are still the parents of the child. So the child also know that they are still, like, they don't have to choose, right? The child will feel very struggle when they see, oh, they are not really good friend between the foster parents and the birth parents. When the child is older, they will feel more secure when they see there is a good relationship between the foster parent and the birth parent. So they love their child, they reassure the birth family, they believe them they can change. I think that's also very important. And also they are very keen, like Kay, she mentioned a lot of different training. I think the foster families are really keen to understand the complex issues of the children in care. I think this is really important because you need to work, you need to navigate such a difficult and complex system. We all need to be equipped. So I think the foster families continuously to learn the issues, to raise the awareness, really make a huge difference for all the children and families that we serve.
Thanks, Leah. So Kay, can you share a real life example of just walking alongside a family whose children were hoping to go home, didn't know how long that would be, but can you share a little bit about just that relationship that you built with the children and their family?
Yeah, so out of my 6 placements, only 2 of them were family reunion cases. And I really didn't know what to expect. I knew that it would be a bit more complex, just because there are birth parents involved. So I just went into it with a very open heart and open mind. But in my experience working with the birth mum, I think one thing that really helped me was I constantly reminded myself that I'm not here to judge, because I think it could be so easy to judge. So I was very mindful of that from the very, very beginning. The day we picked up the children, I will never remember, I will never forget that feeling. And I just cannot imagine how the mum felt. So I'm not here to judge. I mean, like it was just so heartbreaking. So I knew at that moment, again, like a lightning moment, I knew that my job was not only to ensure that the kids were taken care of, but also to support the mum, to empower her, make her feel involved and important in the children's lives, and to keep a strong connection between them. I did not know how I was going to do it, but I just at that moment said, this is what I've got to do. And for me, the last thing I wanted for the children is for them to look back. I don't know if they will remember. Actually, they probably will, but for them to feel that they were abandoned. So the narrative at home was always that they would see mummy soon. We did weekly FaceTime calls. We did, day visits. I would take them out to see their mom and then pick them up in the evenings. I also empowered the mom by having her make some of some small decisions. Like there were some small things that I could easily handle or make a decision, but I would purposely get her involved and ask for her opinion. I wanted her to feel really involved with the children, and I really did believe in her, and I trusted her that she really wanted to, bring her children home again. So in my mind, I had a really clear picture, and that was the day that the kids would go home, they would go running back into their mum's arms as if they were just at my place for a really, really, really long sleepover. And so that was always my, my goal and my vision. So I did whatever I could to kind of realize that. But I do think that we do still keep in contact. I'm still in contact with the mother, and she's doing great. I also want her to know that although we're not related by blood, she can see me as family. She can see me as extended family, like a family friend, and I will be there to support her. Thanks.
Well, thank you, Kay. Thank you for sharing your journey and your story. That's really beautiful. Could Kat or Margot, could we have the next slide up, please? I'll just finish up. So as we put that up, I'll just move. So I think, one of the things that we really thinking about a mother's choice is how can we make sure that that families who come to us in real crisis, how can they thrive as a parent? We can't expect them just to go from this crisis to being a thriving parent in community. Next slide, please. And so we looked all over the world at different kind of examples of things that were going on. And in Hong Kong last year, we piloted a program called Safe Families. Now, some of you may have heard of Safe Families before. It's currently running in the US, UK, and Canada. We've brought it to Asia for the first time. And the idea of Safe Families is that if you see this little model here with the circles, is that mum and baby are together. We're specifically piloting for our mums who are under 25, come to us through our Pregnant Girls services, through that crisis pregnancy. And the goal of Safe Families is that where absolutely possible, mum and baby can stay together, but they have this support network around them. Often our mums are coming from really difficult and challenging family backgrounds. And so we place these trained, motivated, caring volunteers around them just to walk with them and befriend them so that their children don't actually need to enter into the foster care system. And as you can see this quote on the left, this is really just one of our Safe Families volunteers was so clearly able to articulate just the way that it's a way to encourage and love on a mum and her child and keep them in this family unit together. We are very thankful to be able to pilot it. We're in year 2 of a 3-year pilot. We are funded by the UBS Optimus Foundation, and we also have an external evaluation happening by a consultant firm called Child Frontiers. And so we hope to be able to publish that research of how it's gone and really share it to see it. Does this model work? Does it keep children out of the system? Does it empower parents to be able to keep their children and also thrive in their identity as a parent? And does it really build our community? Does it strengthen our community, building us closer together? So this is a pilot program that Mother's Choice has launched just in the past year. I've run out of time now, but we've shared a bunch of other things in our slides and in our appendices that will be sent to all of the participants later. So thank you so much for having us for this time, and I look forward to hearing from our next speaker.
Thank you so much, Leah and Kay and Chloe. Thank you so much for that. That's so interesting. I'm now going to hand it over to Talia Drayak. Talia is a care experienced mother of 9 children. She is the director of the International Parent Advocacy Network and a visiting researcher at Cambridge University. She sits on the Oversight Board for the Promise and on the Expert by Experience Board for the National Children's Bureau. And I'm going to hand over to Talia now. Thanks, Talia.
First, I'd like to say thank you all for having me here. I cannot speak on behalf of foster parents because I've not had the experience of this role, but it was really brilliant to hear the presentation and to hear the experiences from a foster carer's perspective. I feel like we need more of this so that we can build better working relationships and better understand each other. So today I'm going to speak as a parent with lived experience and who supports other people who are going through child welfare systems around the world. Sometimes perhaps I might speak a little too bluntly, so please forgive me. It's a really emotional subject, but I hope, yeah, I'm really thankful that this space has been made so that we can come together and hear from each other's perspectives. Could we change slides, please? So we are living in some great but challenging times. We have vaccines to care for us through pandemics, an internet that connects us across time zones. It's almost magical. But we haven't found and universally and equitably implemented solutions to poverty, disability, domestic violence, mental health challenges, substance misuse, and the myriad of other factors that bring children into foster care. There is so much to be hopeful for in this time when we agree our most common values: equality, community, taking care of our most vulnerable, and an abhorrence of discrimination. We agree that every child should grow up loved, respected, safe, and achieving. There is consensus, however challenging. I Noddington, Westminster in England, who lodged an injunction against Scotland's implementation of the UNCRC, that human rights are vital freedoms which all people should enjoy. Nonetheless, we have this insidious wee thing that can sometimes sneak into our society, across our healthcare, social care, education, and into the general public, this fear that can steal our sense of unity. Professor Andy Bilson's research into the feeding of the fear monster and how it can lead us away from successful relationships guides us back into focusing on what's most important. So consider, from a parent's perspective, sometimes it can feel like government workers charge forth on their noble steeds to rescue princesses and princesses from their cold, neglected, parent-guarded towers. Now, with that parent fear expressed, it is absolutely clear that everyone in child welfare has a sincere and earnest wish to make a difference, to help people, and social workers, and especially foster carers, feel every bit as terrified of having their actions and their wish to help seen in as every bit as negative a light as parents. It's not difficult to become snowballed in emotions that rise up in us when we want to protect children, and in the emotions that rise from feeling stigmatized and judged. Consider from a parent's perspective how challenging it is to be labeled a failed parent. From childhood, we imagine our future selves as parents to our dolls and teddies. Davis expresses the crushing force of being suspected of being a bad mother. To have and raise children is such a milestone in our lives, a significant piece of our identity. And to be deemed to have failed creates a grief beyond simple explanation. It stigmatizes and it isolates. Being expected to build good working relationships with people who have the power to take away your child or who are in your role caring for your child, and with whom there is a perception that they judge you negatively, is beyond what anybody can really achieve. It's a measure of our denial that we label judgmental practices as supportive. Many aren't, but many child protection assessments are largely based on judgment. And there's no room for parental dignity or anything that could be construed as ego in child protection assessments. During an assessment, your entire life, warts and all, are on display, and it can often feel that your entire life is reduced down to only your warts, that the mistakes you have made are the total of your person. Now, child welfare programs and child homes are largely invested in supporting the child, but in many countries, in many programs, the family that the child leaves behind is alone. This is where the unique role of foster carers can become the Rosetta Stone of bridging the gap in whole family support. In many programs, just like the ones you've heard about, around the world, not only do children thrive when in foster care, but family reunification rates can be vastly improved through programs where foster carers are supported to work in partnership with birth parents. Nonetheless, this partnership, so incredibly valuable, is wrought with challenging perspectives. How do you as a foster carer support a parent who may not share your values? How do parents who are grieving for their children, who are ashamed to have them out with their care, work with the very individuals who are now fulfilling that role that they want most in their life, their child? We must begin by seeing each other, perhaps not as the media so fond of pitting us against each other might portray, but see the beauty in those who seek to support, nurture, and help, and see the humanity, potential, and capability of those parents who are facing challenges and in need of support. We owe it to our children to go back to our shared values, the foundation of which is reinvestment in our communities and the very most important, our relationships. Change slide, please. Now, parents and foster carers not only share the same goals to see those children thrive and succeed, but they also share the same challenges. No system is perfect, and more often than not, the challenges that parents and foster carers face come from the system. Focusing on their shared goals, parents and foster carers can be better able to overcome those challenges. In one of my roles, I have the wonderful opportunity to run a parent and carer group in a residential school for children who have additional needs and are accommodated by the state. The parents and staff there often relate that they are frustrated by the fight to support. They're frustrated by the fight for resources. And by coming together and improving communication, they found a hugely beneficial way of working together. But again, the system forces tight timelines, high staff turnover, inconsistent policies. All these stack up and overwhelm. When parents and foster carers come together, they too can increase communication and help support each other through these challenges. In my role as an advocate for parents with learning disabilities, I see time and time again that shared goals are lost due to poor communication. The system isn't good at communication, but people are, especially people with such good hearts. For parents, they find paperwork enormously challenging. It's almost like it's written in a different language. And their emotions make it really hard to hear what's happening in meetings and to really understand what is going on and what is being said that's important. Often parents have such high emotions, they only hear their fears, which makes it really hard to engage, hard to take on board what's happening and what needs to happen. But that's where support from peer-to-peer support, parent advocacy, from foster parents directly can make such a huge difference by helping them understand what's needed of them. Children need their communities, and it needs to be rewritten to underscore that we never grow out of our need for community. Children need communities, parents need communities, foster carers need communities. We're all the same. Parents and foster carers both seek to be good parents and to protect their children. Next slide, please. But working together can be hard. Relationships are the keystone to promoting rights and well-being. Children, whether in care or not, need reliable relationships that make them feel valued, respected, and give them a sense of belonging. Working together with parents can be hard, though. Firstly, it requires a willingness to hold space for shame. Shame and grief are deeply experienced by parents and may be uncomfortable to handle for foster carers and others working with them. It may not make them act their best selves, but by holding space for parents, it helps them to be better able to meet their child's needs and achieve the joint goal of ensuring children are safe, loved, and achieving. Working together also means sharing power through sharing information. In order for parents and foster carers to succeed together, they both need to understand the processes involved. They both need to understand the roles they play in each other's lives and the goals that they are aiming to achieve. And in order to do that, this requires wider support. Foster carers and parents are having a shared experience, but an enormously complicated role of co-parenting these children in challenging situations. Next slide, please. Working together successfully requires resources, not all of which are financial. We must make sure that the resources available are going towards strengthening that which achieves our goals. Parents and foster carers need to be fully supported to achieve together. One mother I've supported who found herself in the position of having her children go into care She had a profoundly effect on my understanding. What struck me from the very first time I spoke to her was how down she was on herself. Over and over again, she would say, I don't deserve anything good. I don't deserve your kindness. I don't deserve support. I don't deserve my children. She was so broken, so wounded from trauma and pain and health issues. And the sledgehammer remedy of removing her children was a devastating blow. I'll never forget taking turns with another parent advocate to sit with this distressed woman, a victim of domestic abuse, a care leaver herself, who was now so broken that she was suicidal. Help should not hurt, it should heal. I found it very upsetting indeed that over the long weekend after her children were traumatically removed, she did not receive one call of concern or support. The system stepped in and it ripped her heart out and never thought to make a single inquiry in relation to her well-being. This kind of experience was what drives parents to feel that the system sees them as replaceable or maybe even unnecessary. It fell to other parents who are peer-to-peer support to pick up the pieces and bridge the gaping chasm of support for adults who are falling apart when they are put under too much pressure, too ill, too underconfident to believe they deserve to be loved, to be safe, to be well. So we picked her up and carried her forward through meeting after meeting, through court hearing after court hearing. We sat with her as she crumbled time and again. We stayed by her side and built her back up, as we do for other parents, and as other parents have done for us. Now make no mistake, it was never going to be in her children's best interest to have their mother fall apart or be discarded or destroyed or dead. That is not meeting the needs of her children. What her children needed was someone to support their mummy. Among parents, we don't judge, we don't other. We cheerlead, we support, we advise, we hold space for the toughest emotions a heart can hold. When this mother was struggling to communicate with social work, felt underconfident to even meet the foster carers with whom her children lived, we were there encouraging her and them to come together and build a pathway forward together. This mother, against all odds, has fought and won against her addiction. She fought and won to escape a domestic abuse relationship. She has fought and won to rebuild her mental health. And she fights every day to believe She fights every day to believe she deserves to be safe, respected, and never abused in any relationship. And now her children are home, and she has begun the process of rebuilding her life, a life that was ripped apart. She is a success story, but not because of having her children removed. She is a success story despite that enormous blow she suffered at her lowest point. She is a success story because her relationship with her peers and the foster carers of her children. Children need their parents, and parents want to be what their children need. I share this to express how resources is not defined by money, but by people. We all need people around us to support us to succeed. As the director for the International Parent Advocacy Network, I take the view that advocacy support, peer mentoring is a valuable resource in supporting parents, both birth parents and foster parents, to meet the children's needs, to create sustainable change, and to increase our ability to work better together. And perhaps we need to remember that we're all parents. Thank you.
Thank you so much, Talia. Wow. A lot has been shared. Very, very powerful statements. Resources are not defined by money, but by relationships. And I think that's a good place to start with our Q&A session. I will turn off my video too because of bandwidth. I hope that's okay. Where Talia left off, by saying, we have to hold space for shame and grief, we achieve together, and that resources are not defined by money, but by relationships as well. Mother's Choice, you've shared so many wonderful examples of working with families to achieve this. And, you've talked to us about safe families. Chloe or Leah, could you tell us a bit more about that? I know you said that the research is some anecdotal information about what you're learning is working through the safe families. What's making it work for those that you have supported through this process?
Sure, thank you, Barbara, for that. I think so. At the moment, we're really in this pilot year. We've matched 6 parents with volunteer friends in the community. And I think at this early stage, we believe it's working because we're seeing these relationships being built. Now, at the beginning, we do have a caseworker who is the one who's bringing in the referral of the parent and who's also training and assessing the volunteer. And they're really matching the mother or the parent and the volunteers based on the needs of the mother, her goals, the things that she'd like to do, and the strength of the volunteers. And I think one of the very special things that we've seen in just even in the past few months when we've launched this program, we have had more than 300 applications of community volunteers who just they really want to get involved and just befriend a vulnerable family and walk alongside them. And as we build the pool of volunteers, we're really able to match specifically to that mum's needs. So, for example, we've got one parent, and she is a mum of twins, and we've actually matched her with a volunteer who has grown-up twins, and she was so excited to have a friend who had experienced what she was going through, because most of our mums that we're walking with, they are really the first in their friend group or their community to have a child, because especially here in Hong Kong, it's kind of we start our families later, and so just being able to have a friend in that situation is really powerful. Our ultimate goal is to see whether 6 months down the line, 12 months down the line, 2 years down the line, is this baby still living with this family? And we really hope yes. So we're not going to have all the data for several years, but at the moment we can see just the strength of relationships. We had one parent who she had been working really hard to take some exams. And while she was studying very hard, the 3 volunteers around her, they coordinated a lot of her childcare needs. And they really supported during that intense time where she was up studying in the middle of the night. And when she completed her exams, they took her out for a celebration. And she just started crying because she said, nobody has celebrated in this way with me before. And so we can just see how powerful a relationship is. And then when you're in crisis, you have someone who you can turn to. Another parent disclosed to her volunteer that she was pregnant. She hadn't told anyone in her family yet, but she knew, even though she'd only met that volunteer a couple of times, she knew that this was a safe person who she could trust. She's validated in her just everything she's experiencing as a new mother. And so I think that's, at the moment, that's how we can tell that it's working. We're collecting about 600 different data points every month. So we want to have this kind of quantitative data as well. But that's really how we know at the beginning from this small scale pilot. So thanks for that question.
Amazing. Thank you so much for that, Chloe. You shared a lot about, generally working with foster parents and all of the amazing work you're doing there. Could you share with us some of the learnings overall, right, that you can share with us? What have you learned to date?
Maybe let me try to go first.
Hand over to Leah.
And I'll pass it over to Chloe. I think one of the learning that I have as a social worker in foster care is I think we know the situations can be very daunting sometimes and seems very daunting. And we are serving the most vulnerable group of children and families in the system. The case is really complex. But I think one of the biggest learning is like we need to have hope on the cases. And foster care is not an end goal for the child. Permanency is. So we have to always center back to our core value and upholding the best principle, best interest of the child principle. And once the child gets into the care, we need to immediately start thinking of how to get them out. That's why we in Mother's Choice have been trying to use different tools to make sure we are really to keep tracking on our case progress. We're doing it on a data-driven, evidence-based to make sure we are really working together to support the family in realizing their family reunion plan or explore other alternative permanency plan for the child. We believe that every child deserves a loving and permanent family, and there is no exception. We believe we are all here today, and actually I'm so touched and really empowered and encouraged by listening to all of your sharing. I think as we are working together here, we will see transformation on the child's life and also the families. Thank you.
Thank you, Leah. Chloe, do you have anything else to add? I know you wanted to jump in as well, but it's okay if you don't.
No, I don't think anything. I think just a real encouragement to just try a crazy idea and see if it works. And especially if it involves our community. I think there's so many people who really want to make a difference. They want to give back. They want to contribute to where they're at. So so try it and see where it goes. And that would be my encouragement, really.
Thank you, Chloe. I'm going to now circle back to Talia, who has shared an amazing perspective of how we work with parents in general. Talia, just one or two questions for you. What are some key recommendations that you have for foster carers and social workers, specifically around, working with parents?
I think I would actually amplify what was said earlier. I think it was Leah who'd spoken about really holding space to not judge and
Right.
to trying to bring it back to how, holding that space for shame is so valuable, and just making space in your life for these people who are temporary, and that hurts so much. But I suppose both parents are going to end up experiencing great grieving. And in that way, it's another shared experience. And I think I couldn't recommend how highly the advice that Leah gave about bringing the mother in and letting her have input into the children and trying to make her feel that she still had a role in their life. Because I think when children are removed from a mother's care, often they feel that that's no longer their place anymore. They've been replaced. And by making them still feel that they have an important role in their child's life, that motivates, that encourages, that builds. But also, I think it's okay sometimes, I think both parties need support. I can't imagine how you can do this on any side of this table, or perhaps in this sitting room, which it really should be. We shouldn't be at a table. We should be all sitting together in comfortable chairs. But, as we remember that we're all human. And so often we're all just one crisis away from needing help. And so just hold that space for each other, and we'll learn from each other. And I'm so heartened by everything I've heard today about how much effort is being put in to try to understand and trying to find a better way forward together.
Thank you. And that really speaks to what you said, right? In terms of achieving together, right? Both foster parent and caregivers and parents need support to achieve together. One more question. Could you share some examples of good practice from your own experience?
Absolutely. There's a number of residential programs, both here in the UK, in the US, in Canada, and in the Netherlands, where families are taken in as a whole, to care for the whole family. That is life-changing, because for so many parents that do end up with their children going into care, they were in care themselves. They don't have a wider support network. because they aged out of care. They never had connections with their own family. They never had maybe a permanent parental figure. And so by taking them in and helping fill some of those gaps, you're almost raising was into, and at the same time raising this next generation. And it can stop what can be a generational snowball, you know? We don't want generation after generation after generation of children coming into care. We want to build strong children to be strong adults. And sometimes that takes nurturing the adults too. And I suppose no child is, you know, all by themselves. They come with it as a package. So by supporting the whole family, that makes such a huge difference.
It really does, doesn't it? Thank you so much, Talia. I want to circle back to Mother's Choice, you know, specifically Leah. You talked to us about this very interesting tool, the CANS tool. Can you share a little bit more about that? There is already interest about assessments, about how we achieve case plans, etc. And that sounds like a very interesting tool. So we would love to hear a little bit more about that.
Thank you, Barbara. CANS, Child Adolescent Needs and Strength. This is the communication tools that we are using in Mother's Choice, but it's also used by over 50 states in United States, and also Singapore is the first Asian country adapted and implemented CANS in Singapore. And then we researched for, I think back in 2015, I think when we tried to explore our case management system, then we stumbled upon the CANS because one of the child welfare agency in the States are using the same case management system, and also like recommend, okay, maybe we should consider using the CANS into our case management framework, because we are looking for a tool that would be reliably and succinctly be able to communicate the needs of our clients, because the CANS include domain about the life functioning of a child, for example, the family relationship, their interpersonal skills, their education, their sleep. And also there is another part of domain focusing on the safety and the risk of a child. If for younger child, for example, there will be birth risk factors that we can identify, whether the child is prematurely born, whether the child is exposed to substance use, whether they are underweight, etc., so that we can plan the level of care based on the needs of the child in different domain. And also how we love the CANS is because it's strength-based as well. There are a domain that would cover all the protective factors of a families. Are they having enough community resources? Are they having enough social support? How can we build up their strength in order to work on the case planning? And also like the CANS, like the ratings driving our decision making, driving the case planning. So we are all working together to really address the different needs identified through the CANS. So this is a really, like, it sounds really scientific. It's really scientific, but it's also very relational. It's collaboration. It meant to be shared with the client as well. The ratings meant to be shared with the client so that the parents would know what are the needs that they are facing and what are the intervention plans that all the social workers involved will be working together, so that we can all working together to really accomplish the goal, which is most of the time is family reunion with the child. So this is the beauty of the CANS, that we can use it as the tools to facilitate the collaboration, to really create a culture that would enable and empower the families who are involved to accomplish the goal with the support from the different professionals. Thank you.
Wonderful. Thank you so much, Leah. You know, I like that you say this helps plan the level of care needed for the child, because, you know, to match the child to the right caregiver who can then specifically provide for the child and adolescent's needs, it's very, very important that we fully understand what those needs are and what those strengths are. And thereby also, you know, the foster parents can also communicate the same information, right, to the birth parents and to the forever families, or whoever that might be. So like you say, you know, working together and relationships through this tool to achieve overall well-being for the children. Thank you so much to Mother's Choice. and to Talia, and a big thank you for to Kai as well, you know, for sharing her very personal stories, and for all of you answering the questions. There are some questions that came in through the chat, but I believe we have, you know, Mother's Choice has answered most through that. If there are other questions that you have, please feel free to put them in. We might not be able to answer them now, but we can circle back to you via email, like Louise shared earlier. So thank you so much, and back to you, Lou.
Thanks, Barbara. Well, thank you. I'll just reiterate that. Thank you so much, Leah and Kay and Chloe and Talia, for giving us so much to think about, such powerful presentations. It's really appreciated. So just to finish here, I just want to tell you about the task force on foster care that we have. We've been meeting after the webinars to talk in more detail about these subjects. The purpose of the task force is to bring together learning and experiences to inform a thematic brief paper on foster care. And I'd really encourage you to join the group. It's not too late to join. We'll be meeting again next Tuesday at 2 different times. So hopefully it will work for whatever time zone you're in. You can access the group on the platform, and there's details in the chat of how to join the platform. So really, please share that widely. It'd be great to get lots of people at the group to share and have a further discussion. So lastly, I just want to thank Catherine and Margot from Better Care Network for all their hard work bringing together this webinar, and also to Nora and Anna for their interpretation for us today. And thanks ever so much for attending. We hope to see you at the next webinar in September. And just a final reminder that this recording will be made available. You'll get emailed the link for the recording and for the slides from the presentation, and details of mine and Barbara's email addresses if you would like further information about the task force or the webinars. Thank you so much, everyone, for being here, and we hope to see you next time.